Can technology help to close the gap in healthcare for women? That's our Techstination. I'm Fred Fishkin. Joining us from the Consumer Technology Association is Health Government Affairs Lead Catherine Pugh. Hi, Catherine.
Hi, good morning, Fred. So glad to be here this morning.
Well, thanks for joining us. The CTA has released a study that has found gaps in the U.S. healthcare system's ability to meet the needs of women. Give us a bit of an overview here.
Yes, thank you, Fred. The Consumer Technology Association recently released a study, The Future of Women's Digital Health Solutions, where we explored the consumer digital health solutions to understand what drives women to adopt and use these tools for health management and inform new features and products. We surveyed more than 1,000 women nationwide, and we found some interesting insights in the market. First and most importantly, I think that the biggest highlight is that 2 in 3 women believe digital health solutions are the future of healthcare and that the solutions can help lower healthcare costs. And also, more than half of those surveyed believe that digital health solutions can help reduce healthcare disparities. I think some other interesting findings are that few women actually have a narrow view. 27% of women have a narrow view of what women's health means, even though often when we talk about women's health, we're talking about solutions that might be unique to women, such as menstrual health apps. But in reality, that there are a lot of different solutions focusing on women's unique health needs throughout our lifespan. Some of the challenges that we found are that 3 in 4 women do face challenges in obtaining healthcare, including high healthcare costs, needing to prioritize their own health, and the limited appointment availability, and then also access to affordable health insurance. So those are some of the top findings, and happy to dig into some of that more.
How are we defining more or less digital health?
Yeah, absolutely. We looked specifically at smartphone apps, telehealth, smartwatches, and wristbands. But also in general, we think of just any technology-enabled healthcare as we consider digital health here at CTA.
Now, there's a new White House initiative related to women's health. Tell us about that and how that might play a role.
Yes, absolutely. So the president announced the Women's Health Initiative, and they have a very ambitious timeline. They commissioned a advisory group that is set across the federal government, and that advisory group has to deliver recommendations to improve women's health within 45 days. Which I think is very ambitious and also much needed, probably late given the gaps that we do see in women's health currently, but better late than never.
It's interesting. The U.S., as many of us know today, has really fallen behind most of the rest of the developed world in terms of women's health and even infant mortality and maternal mortality. It's a perplexing problem, I suppose. Any thoughts about what needs to be done about the roles that technology can play here? I mean, there are some insurance companies, maybe focused more on older adults, that provide gadgets and things for monitoring health. What needs to be done?
Yes, thank you. I think certainly we need to focus on how, as you mentioned, technology can bridge some of these gaps in affordability and access for women. We also need to encourage investment. I was actually just looking at a recent report released by Silicon Valley Bank, their Innovation Women's Health Report. There has been a 314% increase in women's venture capital investment since 2018. And as you mentioned, a lot of that is focused outside of just the fertility applications, which is just a small portion of women's lives, as you know, important, but still just a small portion. So actually 435 million investments were made in non-fertility startups in the third quarter of 2023. And those also, I think importantly, we need to support. And at CTA, we strongly support diversity in startup founders, and 76% of women's health companies have a woman founder. So I think we need to be increasing the access of the tools that do exist to reduce some of those barriers of time and affordability for women, and then also at the same time be supporting women founders and creating opportunities for funding to increase better access in the future.
And of course, during the pandemic, we saw more and more people turning to telemedicine, for instance. I don't know, is the trend continuing to increase the popularity in going online for medical help?
Yes, I think so. And our study shows that these tools, when women use them, are including telehealth, are very popular. They're high satisfaction rates when women actually use these tools. And I think that in turn means that payers, whether that be private payers, insurance providers, or federal, Medicare and Medicaid, that means that they're incentivized to reimburse for some of these tools. And so that's really what we're focusing here at CTA, including through our policy work here in the health division.
Is there a place people can go to for more information?
Yeah, absolutely. Our website is cta.tech, and that covers all of our work, including our health work.
And of course, there's the big Consumer Electronics Show coming up in Las Vegas in January, and there'll be more that's new in digital health and everything else coming out there.
I'd be remiss if I didn't talk about the Digital Health Summit at CES 2024. We have a day and a half of conference programming on health specifically, including our Women's Health Tech panel, where we'll be continuing our discussion around a lot of these themes.
The site again is cta.tech. Catherine Pugh, thank you for spending time with us.
Thank you, Fred.